All right, joining me now with more is the Globe and Mail's Queen's Park reporter, Laura Stone. Hi there, Laura. Great to see you.
Good morning.
So, what did you make of Christine Elliott's response there about the framework? I know you've got some new reporting on that. What are you learning?
Well, Marcia, lots of questions have been swirling about the government's new color-coded framework. A lot of medical experts and public health experts have come out sounding the alarm over the large, very high thresholds that are contained in the framework that would precipitate any closures of businesses. So that's been happening. And then the Toronto Star had an explosive story last night detailing that the head of the public health agency, essentially one of the key players at Public Health Ontario, had recommended much, much lower thresholds than what the final plan ultimately presented, and that she did not see this framework before it had been finalized and released. The government has consistently claimed that they're listening to health experts, that they're listening to science. So this obviously caused a very large ruckus at Queen's Park today. Minister Elliott is saying that the government took into account a variety of voices, that they listened to Public Health Ontario. They also listened to other public health experts, as well as the chief medical officer, Dr. Williams, when they were crafting this plan. And it wasn't simply about the spread of the virus, it was also about the adverse effects that a lockdown can have on society as well, job losses, mental health considerations, as you heard in that clip. And she also told me in our interview this morning that the government is not considering changing these thresholds, at least right now, but the government is going to be under a huge amount of pressure from the health community to reverse this as we get more and more criticism and more people coming forward expressing alarm over it.
Okay, so plenty of alarm out there, as you say, Laura, but I'm wondering if she told you anything concrete about whether or not they're looking at another full lockdown across the province.
Well, I think the government has done everything they can to avoid this. And I think that is contained within the framework. That's the essence of it. It's called keeping Ontario open. And that's why you see these very, very high thresholds to have a lockdown. And that's why we've also seen other regions in Ontario, such as Peel and Toronto, come out and impose even tougher restrictions on their own regions, because clearly they viewed the province's framework as inadequate to contain the spread in their own cities and regions. So I do think the government wants to avoid that route, and they certainly have consistently said that they don't want to close schools. They saw the negative impact of that on young people back in the spring, and so they're going to do everything in their power to stop that. The flip side, and of course where the concern is coming from, is that these cases are rising. We know that the modeling coming out today is going to paint a very, very scary and dire picture of where this province may be headed. So they've got to balance now all these considerations of a spread of the virus, the impact on hospitals, but also the impact on society, people's mental health, and of course the economy.
So many factors to consider. And lastly, I'm wondering, Laura, about the trust factor. Did you get anything from the health minister on where they feel that lies within the people, with the people that live in Ontario? Do they feel that they are still trusted, that they are trusted as a government to be doing the right thing, guiding them the right way through this pandemic?
It's very interesting that you ask that, because the opposition parties have come out and point blank called Premier Ford and called Health Minister Elliott liars because they said that they have been listening to the health experts and crafting their plans. I put that to Minister Elliott, and she said that she has always told the truth about the COVID-19 response. And there was a kind of a long silence before she answered that question. So obviously, their characters are being attacked, and there have always been a lot of question marks and a lot of unanswered questions about who is advising the government, who sits on these tables. It's not entirely clear. It's not like you can just log into a website and look at all these names and draw lines as to who is advising the government. We know some of the key players, but there have always been some holes as to who is advising the government, how the decisions are made, and we know that they're ultimately brought to cabinet. So there are a lot of accusations about this being a political decision over a health decision. So I think that is going to be the key message and the key concern as we see Premier Ford come out today for his daily press conference, and why we've heard from Minister Elliott, because the trust factor, that's certainly going to be their biggest challenge.